What if your twin ate your other twin? The science of vanishing twins. Imagine this. You go for your first ultrasound, filled with excitement and nerves. The sonographer points to the screen and says, "Congratulations, it's twins." Your joy is instantly doubled. 2 babies, maybe a Francis and a Francisca, or a Jack and Jill, or Mary and Martha. 2 futures, 2 tiny lives to plan for. But then, weeks later, at your next appointment, the screen looks different. There's only 1 heartbeat. 1 baby, growing perfectly. The other is simply gone. The doctor explains it's a phenomenon called vanishing twin syndrome. But the question that echoes in your mind is a strange one, a primal one. What if your twin ate your other twin? Today, we're exploring an obstetric complication of twin pregnancies, the fascinating and often misunderstood world of vanishing twin syndrome. We'll explore what really happens, why it occurs, and what it means for the surviving twin and the mother. Stick around. So, what is actually happening when a twin vanishes? The term is a bit of a misnomer. The twin doesn't disappear into thin air. In the early stages of a twin pregnancy, one of the fetuses may unfortunately stop developing for a number of reasons. When this happens, the non-viable fetal tissue, the placenta, and the gestational sac are reabsorbed by the mother's body. Think of it like a plant in a garden that fails to sprout. The soil simply reclaims the nutrients. The mother's body does the same thing. This process is surprisingly common. Vanishing twin syndrome occurs in 20 to 30% of all twin pregnancies, often before the mother even knows she was carrying twins. The why, risk factors and causes, pathoetiology. Okay, so why does this happen? It's almost never anyone's fault. The primary cause is often a random event during development. 1. Chromosomal abnormalities. This is the most common reason. The fetus may have a genetic anomaly that is incompatible with life. The pregnancy stops on its own because it was not viable from the start. 2. Poor implantation. One embryo might not have attached securely to the uterine wall, preventing it from getting the blood supply and nutrients it needs to grow. 3. Placental or cord issues. Sometimes, there can be problems with the umbilical cord or an unequal sharing of the placenta, leaving one twin without enough resources to survive. While it can happen in any pregnancy, some factors can increase the chances, like advanced maternal age, over 30, and pregnancies conceived through IVF, simply because these methods increase the likelihood of multiple embryos implanting in the first place. 1. Genetic issues. 2. Poor implantation. 3. Placental problems. The cannibal twin myth. What really? Let's get back to our title question. Did the surviving twin eat its sibling? The dramatic and simple answer is no. The term for this is fetal resorption, not cannibalism. The surviving twin is completely passive in this process. It's just focused on its own growth and development. The mother's body and the placenta are the ones that do all the work of cleaning up and reabsorbing the non-viable tissue. The catchy title is just a way to talk about a complex biological process, but it's not what's happening medically. Conclusion. For the surviving twin, there are usually no physical health risks, especially if the vanishing occurs early in the first trimester. They simply continue to grow as if it were a single pregnancy all along. For the parents, however, the emotional impact can be significant. It's a unique kind of loss, grieving for a child you briefly knew you had. It's crucial to acknowledge those feelings are valid. So, Vanishing twin syndrome isn't a story of sibling rivalry, but a story of biology, chance, and nature. It's a common, often silent, event that highlights just how complex the journey to birth can be. Call to action. If you learned something new today, please hit that like button and subscribe for more deep dives into the science of the human body. This can be a sensitive topic. If you or someone you know has experienced this, feel free to respectfully share your story in the comments. You never know who might need to hear it. Thanks for watching, and we'll see you in the next video.